Great. So hello, everyone. Liat here from Hyro. We hope you're enjoying Digital Front Door Day so far. And for those who are joining now, welcome. I'm thrilled to be your session host. And feel free to type your questions in the chat, which I'll be moderating and making sure that your questions are answered. So one of our speakers today is actually an alumni from last year's summit. Sarah, it's great to have you back. And welcome to Gretchen Britt, who actually brought this dynamic duo together, as well as Pete, who couldn't make it today. But we had him last year, and you really bring the challenges that IT leaders face to those on the forefront of digital transformation. And we're going to discuss kind of how to avoid misery as an IT leader. I saw that somewhere, and I really liked it. I will pass the mic to you, Sarah, because there's a lot to cover, and you and Gretchen have a lot to share. So I will put myself off stage. And thanks again for joining us as speakers. And hi to our attendees.
Thanks, Liat. Well, I am Sarah Mankis. As she said, I am an alumni, so I'm excited to be back. And, as IT leaders, we're continuing to fight that battle. As, one would say, how do we keep our sanity and keep supporting and driving clinical care forward without compromising ourselves as leaders or, shortcutting things along the way. So I'd like you to welcome, or at least welcome you to my multiverse that I am sharing with Gretchen. And I have a reason for referring to the Marvel multiverse, if you're familiar. So Pete, we're going to give you big hugs and love from afar in Northeast Florida and Kansas. He's preparing for a hurricane. I've actually dodged the preparation bullet at the moment. I'm in Northeast Florida, so we'll probably get a little bit more activity in the next couple of days. So at a high level, I'm Sarah Mankis, Senior Director, Enterprise IT, Ambulatory Network Innovation. I have a wide breadth of responsibilities that fall under my umbrella, ranging from community and affiliate partnerships to enterprise imaging, to telehealth and virtual care, IS communications, business systems, and financial applications at that 1,000-foot view. So I can relate to many of you out there that are probably living in all of these different lands, right? So I'm going to refer to the great Dr. Strange, right? We're having to create our little portal and pop through and hope that we're engaging in the timeline and not disrupting it too terribly much, right? So without further ado, I'd love to hand the virtual microphone to Gretchen to do a quick introduction.
Hello, everyone. I love that Sarah's referring to the multiverse and the Avengers, because anyone who knows me knows that I love the Avengers and all things multiverse and comic book, and it's just right up my alley. So I love that you're going in that direction, Sarah. My name is Gretchen Britt, and I am the VP of IT at Liberty Market. New title, VP of Information Technology and CIO here on campus at Liberty Hospital. We recently, as of 7/1, became a part of the University of Kansas Health System. So have been leading the Liberty Hospital IT now for several years, and it's a community-based hospital and many clinics, and we serve all the way up to the Iowa line here in the up into Missouri and into the Kansas City area. And now we are expanding and growing, and I am just super excited with where our future is going.
So growth, right? Growth is a challenge in itself. Managing growth, how you're looking at incorporating additional patient populations and backing that into a smaller organization. Gretchen, I mean, how are you guys working through that at this point? Are you feeling the pressure?
I think everybody wants to get there and get there now and get there fast. I think that we're definitely being diligent and reviewing how we're going to proceed and integrate our systems to become one. It's going to be a slower process, but looking forward to how we tackle those things and how we provide new tools for our patients and for our providers and users here at Liberty Hospital. It's a very exciting time.
Well, I'd love to get a quick feel for those that are participating. I can't see who we have in the chat or where you're from, but I would love to know what is keeping you up at night. What is your biggest challenge that you're facing as an IT leader in our current environment? I know there's a number of different things that come to mind for me, specifically around, cyber events, budget constraints, trying to get to that, more platform-based approach as you're, navigating away from best of breed solutions. So just curious what you all are contending with.
I'll tell
Anything
you, here at Liberty, I know cybersecurity is always top of mind here for us. I think, as you said, Sarah, budget is a big one. As you're looking at expanding things and walking this line right now, where does it make sense? In any organization, where does it make sense to spend those precious dollars? Our margins are very slim these days, and we have to make sure that we're making the right choices where we are choosing to spend that money and how we can benefit our populations, our patients, our providers, with making those right decisions and working with all of our key stakeholders to make sure that we're taking all that feedback and not just taking one solution that maybe could fix this problem, or could we look at another solution that could have, we could scale and address a few issues that are out there.
Yeah, I agree. So, with cyber in particular, real scenario. So this past weekend, there was an email that came my way where we, had a couple of questions related to an external vendor and, getting the team on high alert, right? Just making sure that we're doing that due diligence to ensure, hey, there's nothing that's impacting our organization. It's more like trust but verify. So, we're constantly on that state of readiness, because it's not a matter of, and I know many leaders are saying this, so I feel like I'm repeating, but it's nothing that shouldn't be repeated, right? It's not if, it's when.
Right.
So it's ensuring that you're postured and well positioned to, respond and react accordingly. But again, that's something that's, for me, it's looming, right? So it's something, it's like that cloud that's over you a little bit, where it's, when is it going to happen? What's going to be the impact? How are we going to respond? How are we going to look at, if we have to hit the red, emergency shut off button saying no, 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 how do we respond to that? And then thinking about, many of these, physicians, nurses, any of the clinical care team, they're native EMR users at this point, having to go back to, paper, right? I always keep my paper. I love to write my notes. But how do you go back in time almost? I mean, that's a tremendous curve.
Yeah.
Gretchen,
And
what do you think?
well, I've unfortunately been there and done that, have been through an event like that. And I think that what I learned a lot is we have to be prepared at all levels, right? You have to protect, you have to defend. But then, it's not if, it's when. Okay, when it does happen, are we truly prepared to care for patients and understand the scale of what that means? You talked about patients maybe, or I'm sorry, our providers, going back to paper. But what about those who have never been to paper? What about those who've never written an order? What about our nurses who have never taken an order off or done a MAR? So I think those are key things that you have to prepare and plan in that business continuity planning that are outside of IT's area, but that our leaders need to make sure that they're taking those forward. And, our organizations truly practicing shutting it all down. I think that's something that could be important to, shut it all down for a period of time. How do you react? We do tabletop exercises, but that's all in theory. So let's get to reality, and what does that look like? And how do you then continue to care for your patients safely?
Well, it's driving that operational ownership. So, IT, and I, have this conversation more often than not. It's, we're not the ones that are creating your downtime process and procedure.
Right.
We can support you and guide you along the way with what we know that's, needing to be recorded in the system when that recovery, time comes. So, having the buy-in at the operational level to, take the onus and responsibility that, hey, we know what we're doing. So if, and when something does happen, that they have, a tick and tide ready to go when we have to, be completely 100% dark for whatever reason.
Absolutely.
I do see a couple of questions in the chat, Gretchen, coming up. Let's see. somebody's challenged with the budget and how you spread your budget that you have across maintaining existing platforms, business models, e.g. EMR. Oh, you're touching on a subject that's near and dear to my heart, right? It's driving towards platforms, platform management, becoming, I would say a single source of truth per whatever your segment is. So, we're going through this exercise now, actually. So a couple of years ago, I think we're a little over 2 years at this point, went to a single medical record, right? So that's a single platform for clinical stakeholders. Now we're on the journey to get to a single ERP platform. So doing that rationalization and consolidation, then you have the IT platform, of which I was having a conversation with a very seasoned CIO several weeks ago. And this platform approach, while it doesn't seem like it's, it seems like a very simple concept, but, getting people to buy into that platform approach is a little bit different. So like, we in IT have our platform. So whether you're a ServiceNow, Easy Vista, or insert ticket ITSM vendor management system here. So we're on that journey. So it's certainly an exciting time. And then there's a reference to AI. So AI platforms. I mean, there's like what, a gajillion out there. So I'm going to go back to the multiverse. So like we'll go through a portal and, somebody's going to, say, oh, this solution has AI and, this has machine learning, et cetera. But, how do you look at assessing and qualifying that as, something that's going to, provide a solution to a problem that actually exists versus, hey, this is a really neat tool or function. It's, how do you fold that into the conversation, Gretchen? I know we have some things that we're doing at Baptist because, we have strong parameters around, AI platforms use and vetting them. So just curious before I jump in, what are you guys doing?
Yeah, well, I'm still learning what we're doing on the other side. I know that they are looking at different policies in place and what technology that we put out there. At Liberty, we've dabbled a little bit, mostly, I think, in our radiology space and some in our revenue cycle. But I think the thing to consider is when you're looking at these different AI platforms is not, do we need to look at it differently? Do you need a separate complete committee out there maybe for AI, or are you going to lose some of those safeguards that you've got in place with your IT governance maybe that you have set up? So I think there's a fine line. Yeah, there's a different lens you do have to look at it with, but at the same time, I want to make sure that we're not missing things over here. So I don't know where that journey is going to take us yet, as I'm still learning the other side. And here at Liberty, we don't have any specific governance other than our IT governance set up for looking at any project. It's all technology.
Yep. And, from Baptist perspective, I mean, we have gone a little bit deeper where we have policy and procedures around AI use. We have an AI governance team. We have a very robust enterprise architecture team that's taking that deep dives to make sure that, what we're looking at potentially incorporating into our systems, and solutions and how that's going to complement, right?
Right.
And many of these large platform vendors now, have AI incorporated. So I think, I believe that will, hopefully curtail some of these, one-off requests that, perhaps are rolling in because, somebody's touting that there's AI. And, I think it was Joseph that was asking about this, or Barry, I can't remember. But yep. So, I mean, when you really think about it, it's, assuring that you have your checklist, right? To make sure that you're not introducing risk, bias, et cetera. We have that all formalized, at least at Baptist.
Right. Well, I'm looking forward to moving down that path. Right now at Liberty, ours is all in one, but we are going to get there.
Absolutely. All right, Gretchen, I'm going to shift gears a little bit. So, it's Digital Front Door Day. So happy Digital Front Door Day, everyone, and any of the returning attendees. So let's talk about that. How do you guys define a digital front door at Liberty?
So I think digital front door is all about access, right? It's access points for our people. It's access to appointments. It's access to education. It's access to information. It's access to how much money am I going to have to pay for this procedure? It's all about access for them, and all of those points of contact that you can present to your patients it's that the first face that they see, right? It's the first contact. How important is that? First impressions are everything. So then when you have your digital front door, you want to make sure that it's a welcoming space for your people, and that it provides them with ease, the information and utilities that they need, really.
Yeah, and I don't know if it was at this session. I think Liat, you'll have to fact check me here, but I'm going to throw it out there. But I believe Donna Roach had a presentation for you guys, or was involved with you guys, and it's not necessarily a front door, right?
Mhm.
She pointed out last year that there's many different points of entry. So when it comes down to it, it's dynamic.
Mhm.
But that also centers around, for us at Baptist, right? We have a single wraparound where you have that one-stop shop for your patient. But you take it a step further, it's not just about the app, right?
Mhm.
I may be an app person, but I also may be somebody that may be a bit more inclined to use, the web-based access. So having that flexibility to, access what I need, when I need it, and how I need it is a critical piece. So, there's so many different dynamic points of entry when it comes down to, I think an organization, making hey, can you really define what your digital front door is? Because it's almost like you're constantly evolving as, new things, whether it's a feature function or, something that new that's emerging within, I don't know, marketing, for example, and how you fold that in to make it a cohesive experience.
I love that you have a wraparound front porch. That's, you don't see those these days when we're building, right? I love a wraparound front porch. So I think that's awesome. I think I was just talking with one of our physicians, I think an hour ago. I ran over to one of our clinics, and we were just talking about how much it has improved his ability to interact with his patients, right? And that movement over there to get patients to interact with them, over messaging and those simple things versus, keeping his nurses off of the phone so that they can go in and provide shots and do the things that they need to do and check patients in. So, I mean, I think the key is to provide those services and to meet our patients where they're at.
Yeah, and that's you actually have some direct experience with that, right,
Oh,
Gretchen? So you were a nurse in a past life, so being
yes.
able to not be tied down or bogged down with some of the administrative nonsense that you had to do outside of being present with, right, it was NICU babies, right?
That's right. That's right.
Yep.
Very good. Good memory. I think
Yeah.
that is key. We have to keep our people practicing. Our focus should always be on our patients. And anytime that I'm throwing with any technology a barrier to that, it can't be what we're striving for, right? We need to be able to focus on our patients. And I think any decision that we make and any new technology that we choose, as long as we keep the patients at the center of that decision, and as we keep our end users in mind, right? It doesn't make sense to provide a technology that looks good from one side, but isn't giving extra work to the other. I think that's something that we have to make sure that we're looking at the whole and how we roll those things out. But yeah, as a nurse, I want to focus on my patients for sure.
Yeah, it's the patient, and that's what it's all about. So, the right patient, right message, right time. So, this is, and I referred to marketing a little bit earlier, but, the partnership between marketing and IT when it comes to engaging your patients is like mission critical for us. So if you're
Absolutely.
not meeting with your marketing colleagues, partners, you're missing out on a very fruitful opportunity because they have so many insights that could be shared that could inform and guide the things that we're doing within the technology space that could grow leaps and bounds of improvements overall. We look at our patients really in a 360 format, so that folds in CRM data with EHR data, and how we look at tuning, engaging that patient, whether it's specific timing of when they're more likely to read an email, to tailoring messages to an SMS outlet based off of what we've learned about them, whether it's through psychographic segmentation, referral data, market research around what's happening in their zip code. So really getting to know Gretchen as a patient, or Barry as a patient, we want to make sure that we're engaging you appropriately and timely, and, getting getting to goal, right?
Right.
So a quick example of something that we've done at Baptist is, really leveraging that consumer 360. And we started out with mammograms. So you have a very focused and targeted population on, how we're trying to, get patients back in and on a regular cadence for their mammograms. As you know, some of these, outpatient, preventative diagnostic procedures or, studies were on the decline in 2019. And I think we're still recovering from some of that, which, with us being able to market and tailor communications to, whether it's somebody that just turned 40 or perhaps they, fell off of their regular schedule, to get them, rolling back in, but also knowing your patient, because that patient could have had a mastectomy, or, perhaps they passed away. There's so many different scenarios, right?
Right.
How would you, I think about it on the receiving end. Like, if I am getting something and I know that I have a, significant history of breast cancer that was aggressive that led to a mastectomy, how would that make me feel as a person? Like, don't you have all my information? Don't you
Right.
know me? Do
Right.
you even care?
Right.
It's like, I'm not just a transaction. I'm a
Mhm.
patient engaging in my healthcare. So, and looking at that and tailoring the way that we're engaging that, particular, population, we saw a 15% conversion rate just
Mm,
by sheer engaging, via email.
That's amazing. That is truly amazing. I think that again goes back to meeting your patients where they're at. I had an appointment here recently at one of our clinics, and um, there was a little phone tag going on, and then they reached out to me, and we did all of our scheduling through text through the portal. And I thought that was just an amazing way to, yeah, I remember her saying, "Hey, I know you're really busy, and this is probably a better way for us to communicate." That told me that she knows me as a patient, right? And that she is going to work with me where I'm at so that we can get this little procedure scheduled and get moving on it. So I think that's so important. I love how you guys are doing that and looking at that whole picture for your patients.
Right. It's all about the patient outcome.
Right.
It's not about the tech. It's how you marry it up and merge that into the clinical workflow. And then, also keeping the patient at the center of that, Gretchen. I
Right.
think that's where you're gonna reap the reward, right? You
100%.
keep that focus, because there are so many times where we as leaders get, pulled into so many different directions, right? And sometimes you forget about, oh, hey, I need to fold in clinical workflow. Oh,
Mhm.
hey, I need to fold in thinking about that patient. It's not about just taking the upgrade. You got to think about all those, downstream impacts or, residuals that could occur. Perhaps that update at, 9 a.m. when MedPass is going on is not the best idea.
Never a good idea, right? Never a good idea. Yeah, I think people and process has to be taken into account in everything that we do. I think, you know, people want new, fun, shiny toys. This is always a thing that we hear about. And this is probably not going to be new information out there to anyone either. But, the new shiny toy is not going to break something if the process is broken. So I think that's where it comes in to making sure that you have all those stakeholders. What is the true problem that we are trying to solve? Do we even have that problem that this shiny toy is going to address? And then how do we make sure that we've got operations in line? And then, okay, now operations are in line. Now, do we need to add on this layer of technology to then take us to the next level? So I think that's key to make sure that you're working with all of your stakeholders. And I love that you brought up marketing. I've actually had the experience where we missed marketing in something when we were rolling out direct scheduling to mammography, and the project is going along, and then all of a sudden we were like, oh, this needs to go on our website. How's this all going to work? And it was that big aha that was a missing piece to the puzzle. That we make sure now that marketing is clued in on everything and building that relationship and making sure that we are working together and not against each other. I think that was a big aha for me several years back when we missed that one.
Yeah, and Gretchen, the other piece, I just had a fleeting thought. When it comes to patients and how they're interacting and engaging with your technology tools, we had the opportunity at Baptist to participate in the development of a patient voice survey that was really specifically centered on, patients' experiences with technology in particular. And boy, was that an eye opener.
Yeah.
it was, it quickly surmised, and I think it was, maybe over 5,000 responses or something that we got back, that we needed to do something about online scheduling.
Yeah.
We had limited access for, existing patients that were able to schedule follow-up appointments, but really opening that pipeline, was a message that was relayed loud and clear from those in our region. So I'm just curious, Gretchen, what do you think your biggest challenge is with a digital front door, AKA, multiverse, many dynamic points of entry?
I think for us is that we here on the Liberty side is that we don't have one record yet, right? So we do have so many different entry points, and that interoperability or lack of interoperability that exists where I, Gretchen Britt, go over to my clinic and then I come over to the hospital, and that information is not always right there and readily available, right? Because those are different systems. So that is a struggle for us, just in that user interface. So we've really tried to work hard with our marketing department to make it as smooth as possible on the front end. When they do come to our hospital's website, that it doesn't come off that we are separate, right? So how can we make that better for them? And as easy as possible, even with our bill pay, for example. I remember our revenue cycle VP was really wanting to streamline our bill pay and how that works, and making sure that it looks like maybe we're one on the front end, even if we're really not on the back end. So definitely not having one record has been tricky for us.
Yeah. And I see that Larry has asked a question. Has your org documented the financial impact of DFD, e.g., routing patients to the right resource so that the right setting unlocks capacity and drives RVUs for the most experienced resources? So we haven't gone as far as financials. However, we did incorporate disease-specific scheduling, Larry, where we were having challenges specifically within our cancer center space, so Baptist MD Anderson, where we have patients that were being scheduled with, surgeons or, the wrong cancer-specific specialist. So perhaps they were there for a surgical consult and they ended up being scheduled with a hematologist or something, just making up a scenario.
Mhm.
But, long story short, when you get that patient to the right provider, I mean, you're going to immediately see that return patient satisfaction, time to, from scheduling to being seen by the provider. We quantified just specifically based on the net promoter score, where we went to above, I think it was like 95%, give or take. But it was truly a difference maker for us, because once you got that person or that individual, already navigating a very complex situation, that we had nurses triaging and assessing and then guiding the scheduling of that appointment specifically, that I certainly think that we can quantify something financially, but we haven't taken it quite that far yet.
Yeah, and Larry, not for us, but you're welcome to come hang out at Liberty and help us with that. It sounds like you've got some good ideas. I think anytime you're looking at throughput and how we can improve that, I think that's an important thing, and looking at all factors. But we have not gone down that path yet.
All right, we're creeping up on time. I can't believe it. This 30 minutes has flown by. So, Gretchen, let's think about this long term, right? What's happening in 2025? What are we feeling? What's your focus? What's your
2025.
trend?
Well, I'm going to be
Can you believe it?
integrating. I'm going to be, I'll be in integration mode for the duration. So I'm looking forward to hearing lessons learned from you on how you all went from your records over to your one system now. So I think for us, it's integration and becoming one health system is going to be our focus through 2025 for sure. We're going to be very, very busy. I don't look to have much downtime.
Yeah, I know you won't. You're a busy lady out there in
How
the
about you?
Midwest. So, for Baptist, it's I can say that our continued focus is around partnerships, right? Partnerships with, kind of on the same vein as you a little bit, not mergers and acquisitions, but really fostering and developing partnerships with our key partners in the community in particular is one of the keys, right? So community-based outcomes continuing to drive and be that recognized brand in our community. And I think a lot of the things that Baptist has done over the past couple of years in particular has really set us apart and differentiated us in our market in particular. And that's why we have the problem that we have, right? Not enough providers to care for all the patients that are coming to our community.
Access, right?
Exactly.
Yeah.
Well, I don't know who's all out there, but throw your trends, anything you're working on, any of those hot topics that are, going to be key for others that may come back and watch this recording. I appreciate all of your time this afternoon. Good luck, and we will see you in the multiverse somewhere. I'm opening the door for you all. You have a contact. I'm on LinkedIn. Gretchen's on LinkedIn, so feel free to reach out to us at any point in time.
Thank you, ladies. I was going to ask if how folks can reach you and if you're okay with them adding you on LinkedIn. So I'm seeing nods and yes, they would be lucky to be able to pick your brains. This was a very insightful session. Thank you so much. We do have now a 5-minute break until the next session. Next sessions are Tales from the Trenches, Lessons Learned from the Front Lines of Healthcare Transformation. That's going to be with St. Luke's, Renown Health, and WakeMed. So don't miss that. And then in the other room, it's Building Trust, AI Governance, and Policy Frameworks for Digital Healthcare. So yeah, lots of
Barry, you hop over there. That's the place to be.
Yes, Barry. I'm grabbing Larry with me to go to that other room after his coffee break. We'll let him have a break because he's been very active today. So thank you, Larry. Ladies, it's always a pleasure. I can't wait to have you back next year and hear what you've been doing, paving the way in digital innovation. So we appreciate you, and healthcare is lucky to have you. And thanks so much.
Thank you.
Thank you.
Bye. Have a
Bye,
thumbs
guys.
up it.